So we discussed the various types of seizures in the module intro, so we want to review quickly what the possible causes are. Now, the most important thing here is that you recognize that when someone has one of these conditions, they're at risk for seizures so that you treat them appropriately. Now, seizures or seizure disorders can be caused by non-modifiable risk factors like genetics, age, family history, etc., or also prenatal injuries like hypoxia can cause seizure disorders. But we'll also see conditions within the brain itself, as well as within the rest of the body system that can contribute to a patient's risk for seizures. So let's look at those conditions a little closer. Now, the reality is that any condition that affects the brain and the neurons can cause seizures. So this includes things like head trauma, like concussions, or any kind of car accident, a motor vehicle collision. Also things like brain tumors or bleeding on the brain, as well as any kind of swelling within the brain tissue. All of those things are going to cause increased intracranial pressure. They're going to put pressure on the nerves and the neurons, and they can potentially cause seizures. And then, of course, strokes. Strokes, I like to say, lead to things like short circuits in some of the neurons in the brain. And so they can also lead to these neurons firing erratically. Now, there's other conditions within the body that can also contribute to a patient developing seizures. One of those is drug toxicity or withdrawal. We actually see this a lot with alcohol withdrawal. Now, one of the other things is infections like meningitis. Meningitis, as we will talk about in the meningitis lesson, can cause irritation to the neurons because it's irritating the lining of the brain. And then patients with acute febrile state or high fevers are also at risk. I actually had a patient once who was an inmate at a Texas prison over the summer. He wasn't allowed inside and his temperature got to over 106. They brought him in because he started having seizures. Now, we'll also see seizures with thiamine deficiencies. And then finally, one of the big ones is alterations in sodium levels, both high and low. Remember that the amount of sodium within the vessels can cause that fluid to shift. If there's an excess amount of sodium, the fluid's going to shift out of the tissues and cells and into the vessel. Or if there's not very much sodium at all, then the fluid will shift out of the vessels and into the cells. So with hypernatremia, you get cellular dehydration because the fluid shifts into the vessels and out of the cells. With hyponatremia, you actually get cerebral edema because the fluid is going to shift out of the vessels and into the cells. Either way, both of those conditions can cause the patient to have a seizure. So that's why it's really important that we regulate those sodium levels really closely in the normal range between 135 and 145. Remember that status epilepticus is a state of persistent, non-stop seizure activity. So when you think status, I want you to think it's an exacerbation of a seizure disorder. Something is going wrong that's making their seizure condition worse. It could be that they had a change in medication and it wasn't therapeutic enough, or even that they haven't been taking it. We see this a lot in the emergency department. Or it could be that they had some sort of acute illness or injury that is causing irritation in their brain. Either way, when you think status epilepticus, I want you to think exacerbation. So let's recap. Seizures could be caused by non-modifiable risk factors like genetics, age, or family history. They could be caused by issues within the brain itself, like head injuries, brain tumors, or strokes, or they could be caused by systemic problems like infection or fever, hyper or hyponatremia, or drug toxicity or withdrawal. And then remember that status epilepticus is an exacerbation of a seizure disorder that could be caused by things like a change in medication or some sort of acute illness or injury. So keep working through the seizure module to learn more about assessment, therapeutic management, and nursing care for patients with seizures. Go out and be your best selves today. And as always, happy nursing.